Today our group is going to talk about brucellosis, and our group included Kayleen Lyons, Liz Pereira, David Brecky, and Rachel Sandoval. The first Brucella bacteria were isolated from a man who died of Malta fever. David Bruce, the British Army surgeon who isolated the bacteria, named it Micrococcus melitensis, but the genus was later changed to Brucella. The disease Malta fever, and therefore the bacteria, was associated with people who had contact with goats or drank their milk. The abortus strain was isolated from a cow's udder in 1897, and the Sus strain was isolated from swine in 1914. The disease was called undulant fever until the 1940s, when it was renamed brucellosis. In 1894, the first case was diagnosed in the United States. The patient was a goat herder who drank their milk near the Texas-Mexico border. A state-federal cooperative eradication program was started in 1951, which reduced the number of brucellosis infections in cattle by a significant amount. In bovines, the clinical symptoms are infertility in bulls and abortion between the 5th and 8th months of pregnancy, increased risk of retained placenta, sterility or difficulty rebreeding, weak calves, and reduced milk yield in cows. This is a picture of one of the long-term effects of brucellosis, which is arthritis and extremely swollen joints. The human symptoms are very similar to the flu. They include fever, sweats, headaches, back pain, and physical weakness. The long-term effects are fever, joint pain, and fatigue. In sheep, they may show the following symptoms: abortion in ewes, and in rams, epididymitis, which can result in infertility, sterility, and lesions in the testes and epididymis that can be palpated. The number of known brucellosis infections in cattle herds in the United States has dropped from 124,000 in 1956 to 700 herds in 1992. In June 2006, there were only 6 known herds, and in February 2011, an infected herd was found in Texas. The cattle were immediately quarantined, so the state did not lose its Class A status. To be eligible for a Class A status, a state must have an infection rate of 2.5 out of 1,000 herds or less for 1 year. A class-free status is given to states that are brucellosis-free. And all other herds in the U.S. are free currently. The U.S. is brucellosis-free in cattle, but it is still found in elk and bison in Yellowstone. And brucellosis has 5 different species or strains, each with the genus Brucella. The strains are Brucella abortus, Brucella melitensis, Brucella ovis, Brucella sus, and Brucella canis. Of these 5 strains, Brucella abortus affects the widest variety of animals. It affects cows, sheep, goats, pigs, horses, humans, and dogs.
The Brucella bacteria enters the cow through mucous membranes and spreads to the udder, lymph nodes, and the uterus. This causes placentitis, an infection of the cotyledons. The cotyledons will appear normal to necrotic, so they look like they are dead tissue, red or yellow. The intercotyledonary area will also be affected. It can become thick, wet, and leathery in appearance. The bacteria can be spread to other animals through uterine discharge and milk. In bulls, Brucella will often localize in the testis. This causes infection of the ampulla, seminal vesicles, testicles, and the epididymis. Inflammatory lesions will also occur throughout the reproductive tract, and the bacteria is spread through semen. In the image shown, the infected epididymis is of a ram, and it is shown on the right, while the one on the left appears normal. Brucellosis can be prevented with vaccinations. The most common of these vaccinations is strain 19 or RB51, because it does not cause the production of antibodies that could lead to a false positive during brucellosis testing. Calves should receive a vaccination around 4 to 6 months of age, and all cattle should receive a tattoo on the ear at the end of the year that the vaccination was given. The vaccine should be administered by a veterinarian. There are also several tests currently available to cattle farmers. These allow infected cows to be caught early, which will enable the farmer to save the rest of the herd from contracting it. The brucellosis ring test is commonly used in dairies. A milk sample is taken from each cow in the herd, and killed Brucella bacteria is added to it. If a bluish ring forms at the cream line when the cream begins rising, this indicates that there is one or more infected cows in the herd. When this occurs, further testing should be done, as you should narrow down which cow is actually infected. The next step would be a blood agglutination test, or a brucellosis card test. The blood agglutination test involves obtaining a blood sample from every cow and mixing dead Brucella bacteria in it. If the blood agglutinates or clumps together, then the cow has brucellosis. The brucellosis card test can be done on site. The blood serum of each cow is mixed with the test fluid, and the results are shown just after 4 minutes. There are also several programs that have been created to prevent the spread of brucellosis. The Market Cattle Identification Program uses back tags or ear tags to track animals in sales or at slaughter plants in case an infection is discovered. The Cooperative State-Federal Brucellosis Eradication Program is the authority that declares whether a state is class free, with no cases of brucellosis for a certain period of time, or Class A. The time allotted for this is 12 months consecutively. When a herd is Class A, it means that there are less than 2.5 herds out of 1,000 that are known to be infected. Currently, there are 44 states with a class-free status, and the other 6 are Class A. Once an animal contracts brucellosis, it will be infected for life, even if it does not always show the symptoms. It is chronic. There is no known cure for brucellosis, so infected animals must be culled and slaughtered. However, if a human is diagnosed early enough, they can be treated with tetracycline. Many times, a cow will not show signs of brucellosis infection until she aborts a calf between 5 and 8 months of pregnancy. The infection is chronic, so infected animals will have it for the rest of their life. The bacteria can also live up to 2 months in the outside environment if it is cool. In humans, the incubation time varies from 5 to 30 days. The real cost of a brucellosis infection is the loss of an entire cattle herd. More specifically, most states spend between $1 million and $2 million on testing. The RB51 vaccine only costs about $1.60 per head, so the most obvious choice is to spend this amount per cow instead of risking brucellosis infection and losing cows that are worth about $1,000 each. Before an eradication program was started in 1951, the United States dairy producers lost an estimated $449 billion annually due to adjusted inflation. Over $3.5 billion have been invested in eradication programs, and if these didn't exist, the U.S. would lose an estimated $800 million per year in dairy and meat products from cattle. In conclusion, brucellosis is a bacterial infection that affects many different types of livestock and even humans. It is spread through mucous membranes and causes abortion in cows and infertility in bulls. Although there is no treatment besides culling and slaughtering infected animals, the disease can be prevented by vaccines and testing. There are many federal regulations in the United States regarding brucellosis prevention, and these should be followed closely. Thank you.